Thank you, sir. Good afternoon. At the outset, I thank the organizers for giving me this opportunity and also Dr. Sonia for introducing me to the delegates. In the next 15 minutes, I will be speaking about alarm fatigue, which is not quite commonly taken as a patient safety issue. And the objectives of my presentation are to improve the awareness on alarm fatigue as a patient safety issue, define alarm fatigue and its causes, list strategies that clinicians can employ to address alarm fatigue. Before going on, let us watch this video, which is an incident in any ICU, but not a very common occurrence. Can you just open this video? I already told them.
Hey miss, are you okay?
Something is going off here.
I think it's one of your leads. I'm going to fix it. Here you go. That's better. Are you okay? Alright? Did you sleep yesterday night? Let me know if you need something.
Hi, Lindsay. Your patient in the bed number 5 and the alarm is beeping.
I know. It has been going off all day. It's just from the pump and its obstructions or whatever.
Are you sure?
I will decide when I'm ready. I have to give her medications.
Let me know if you need any help.
Thanks, yeah.
Code blue, 3 west, room 123. Code blue.
Oh my god, it is not your patient?
In this video, you saw a nurse who missed a critical alarm because she was overwhelmed with the nuisance alarms. And I can very well say that this is not an uncommon occurrence in any ICU. The word alarm originates the French word al-arm, which means to get your weapons in the face of a threat or enemy. Alarms are essential and necessary to monitor the vital signs necessary for supporting life, and they are intended to prevent patient harm by providing rapid reactions to critical situations. And alarm fatigue is the direct result of the constant bells, blips, and alarm signals emitted by medical devices. And these are likely to go up in the future because of more and more devices being used. The clinicians working in the ICU becomes desensitized, overwhelmed, and immune to the sound of an alarm that they will either turn down the alarm volume or turn off the alarm or adjust alarm settings, which can have fatal consequences. When you enter a patient care area like the ICU, you have numerous infusion pumps giving alarms, you have the ventilators, you have monitors, you have dialysis machine, you have ECMO machine. All these will be giving continuous alarms. And your auditory sensation will get overloaded with these inputs so that it doesn't function as it is intended to. The JCI says that there are hundreds of alarm signals per patient per day, which amounts to around 10,000 alarm signals per day in a hospital. And please note that more than 85%, up to 99% of these alarms do not require any action. That is, they are just alarming without any purpose. The ECRI has included alarm fatigue as a patient safety concern. And since their inception, it's there in the top 10 health technology hazards. In 2010, there was a report in the Boston Globe which says about alarm fatigue related to a patient death. And this happened in a major university hospital. A patient post-cardiac surgery who was awaiting pacemaker implantation, was quite well. He had his breakfast, visited family visited him, had his bath, he was okay. And then his heart rate started falling down. The warning alarms went off, but the heart rate plummeted and the patient became unresponsive. But the critical alarms did not work as it was switched off by the allotted nurse the previous day. So the investigators concluded that alarm fatigue experienced by nurses working among constantly beeping monitors contributed to the death of the patient. And this served as an eye-opener for agencies to focus on alarm fatigue as a safety issue. In 2013, the JCI Sentinel Event Report alerted about the medical device alarm safety in hospitals. And between 2009 and 2012, there were 98 alarm-related events, of which 80 resulted in death of the patient and 13 resulted in permanent loss of function. We are careful about the hospital-acquired infections, we are careful about the infection control practices and all, but we have a tendency to neglect issues arising out of the alarm. And this alarm fatigue, that is the reason why the alarm fatigue remains underreported. And the solution needs leadership and multidisciplinary approach. Any patient who have been in the ICU for more than a couple of days will have some sort of post-intensive care syndrome. And sleeplessness is one of the most important contributing factor for the post-intensive care syndrome. And excessive noise in the ICU is one of the contributing factor for the sleeplessness. And the excessive noise in the ICU, the family perceive it as a poor care quality. They become annoyed, and it is not uncommon for relatives to ask the relevance or why the alarm is beeping when they come to visit their relatives. In patients, the lack of sleep, the increased anxiety, all predisposes them to delirium, which require more medications, which increases the length of stay. The excessive noise has also effect on the staff working in the ICU. It's one of the important cause of burnout syndrome in staff. And sleep is very critical for the well-being of anyone. And hospitals, the centers of healing are ironically the places where you have difficulty in getting a good quality sleep. And WHO recommends 35 to 40 decibel of noise level in the hospital during day and 40 decibel at night. As part of our alarm management strategy, we analyzed the noise level in various areas of our hospital. And during the daytime at 9 a.m. in the ICU it was 65, and in midnight it was 46. It was above the prescribed limit, so we have implemented some measures to decrease it, and we will audit it once the implementation is done. World over, it's almost the same. It's above the WHO prescribed limit. There was a study investigating the cause of alarm fatigue and its associated factors. And most common reason for the alarm fatigue was the excessive noise, the continuous alarming by the nuisance alarm, which do not require any action. And only a minority of the clinicians adjust the alarm depending on the clinical status of the patient. So the purpose of the clinical alarm is to enhance patient safety, and a perfect alarm system should never miss an event and never alarm when there is no event. And most commonly, the nuisance alarms are caused by either a lead displacement and or the alarm settings are not customized to the patient. Like a patient may be having a COPD patient may be having a saturation of 88 at home, but if the SpO2 alarm is kept at 90, it will go on continuously. So there is a general agreement that alarm fatigue is a major safety issue, and hospital have to analyze their own situation and implement strategies to better manage the alarms. The National Patient Safety Goals proposed by JCI aims to decrease the alarm fatigue, and they plan to implement it in 2 phases. That is, phase 1 from 2014 January to 2016, and phase 2 from 2016 January. The elements are: leadership should establish alarm management as an organizational priority, identify the most important alarms to manage, because some patients will be having many alarms which is not indicated for them, or which, they may be having monitors which is not required for them. Identify risk to patients due to lack of response or malfunction. Identify actionable versus nuisance alarm, and publish best practices and guidelines. And in the phase 2, each patient should have clinically appropriate settings of alarms, and there should be a person privileged to set, change, or turn off parameters, check individual alarm signals for accurate settings, proper operation, and detectability, and educate those in organization about alarm policies. So what is the benefit after implementing these changes? There is a review article by Bash and colleague published in 2018. They evaluated 21 studies and came to the conclusion that alarm system management decreased the total number of alarms by 54%, and there is an overall reduction of noise level in the ICU. And 27% reduction in the alarm fatigue, and 64% nurses found the noise acceptable. And also the nurses became more confident in alarm management. There is one study which analyzed the cost benefit of reducing unwanted alarms. By reducing the unwanted alarms, they were able to reduce the cost of monitoring by 42%. To summarize, alarm hazards are a growing patient safety issue. More and more patient monitors are being developed each day, so in the future, the alarm hazards are going to increase. Hospitals and safety professionals should be aware of the hazards due to the alarm fatigue and should take proactive measures in managing them. And also training users to use medical devices in a better way. Thank you.